Hello, good evening, everyone. I'm sorry for this delay. It was completely technical. So let's begin. I am Dr. Namrata Rajput, obstetrician and gynecologist, practicing at Srijan Women Care and Fertility Center, Borivali West, Mumbai. At Srijan, we deal with adolescents to uh, fertility, conception, delivery, and gynecological problems. We are reproductive endocrinologists, and we are a team of two doctors, Dr. Amit Upadhyay and myself, who take care of all our patients. At Srijan, we have a state-of-art lab available with which we do all our fertility treatments, including IUIs and IVF or test tube babies. Now, let's move on to today's topic, which is myths and facts about pregnancy. Due to this delay, I'll keep things a little more short than I would usually have. Uh, First, I'm going to talk about the commonest myths which I have come across in my practice. A couple of them I will discuss, and then I'll move on quickly to the questions. The first myth which I usually get is when the woman falls pregnant is that everybody is very happy, the husband, the family members, and they all want to give her love and food. They keep telling her to eat for two people. I understand the love, the care which everybody wants to give to the woman, and it is a blessing to be felt to feel that. But there is no need to be fed too. It is said that in the entire pregnancy, in the last 3 to 4 months, you require an additional calorie of 300 to 400. But when the pregnancy begins, the nutritional requirement of the baby is minimal. You need not change your diet. The only thing is that you have to keep it healthy so that you eat nutritious food, gain appropriate weight, gain all the vitamins and nutrition which is required for the healthy growth of the baby. That is most essential. Eating for two is never required in the pregnancy. Secondly, in the first 3 months of pregnancy, there are quite some time that the woman loses weight. This is also very common and absolutely normal. There is no need to worry. One needs to understand in the first 3 months of pregnancy, there's a lot of morning sickness or vomiting in a patient, and this vomiting reduces the appetite of the lady, and that can result in weight loss. You need to know that baby is hardly a centimeter or two and has no weight of itself. So, because of that, you are not going to gain any weight. So I want every parent and the family members to relax on this point. The next most common thing is that these days we do a lot of ultrasounds. I mean, there are times when we are blamed that we do ultrasounds more frequently and that हमारे ज़माने में ये नहीं होता था. I agree. In yesteryears, we used to not have ultrasound so commonly, and things were moving on perfectly okay. But in today's day and age and world, when we go from coal trains to bullet trains, that's when the ultrasound comes into the picture. Ultrasound not only gives us a fair idea about how the pregnancy is moving on, whether the baby is healthy or not, normal or not, and whether there is any risk to the baby or the mother. So ultrasounds are very essential, and ultrasound uses sonar energy, that is the sound. It is a sound energy which it uses and not any X-rays or abnormal radiations, and so it's pretty safe in pregnancy. That is the next. The next myth which I hear a lot, is that pregnant women are not supposed to fly. Well, for flight air hostesses, yes, because their flying hours are too many and too much, and so they are prohibited from flying once they fall pregnant, because at that a much amount the radiation exposure increases. But for normal pregnant women who occasionally may go on a flight, it is perfectly normal to move on flight. Yes, there are some restrictions which are from the flight holders themselves, that they do not allow women beyond the age of 28 or 32 weeks to fly. But this is more because in case of any kind of delivery, an emergency landing may have to be done, which will be very much inconvenient or a lot of loss to everybody around. So that was my other thing. The next myth which I usually hear is that very common is that you should eat a lot of ghee in pregnancy. I in fact have the bahu and the sas sitting in front of me, and the sas insisting on her eating ghee and she refusing, or they are all eating a lot of ghee. Well, ghee is actually good and healthy. I must say it's better than oil, but to give ghee with the purpose that the baby will be chubby or the purpose that the labor will be smooth is not right. Now, ghee does nothing of that sort. It only makes you more round. It puts on calories, it puts on weight at all the wrong places and does not benefit much. So, ghee in normal amounts is all right, but an excess amount, expecting a pregnancy to happen, is of no point. So that is about ghee. And the next thing which I see very frequently is about hot showers, dyeing. That can I do dyeing or anything of that sort? So hair dye is perfectly permitted in pregnancy. You can. Hot showers, not very hot showers, but normal moderate showers are perfectly normal. You can wash your hair. It is not going to harm your pregnancy in any which ways. And another myth which I've come across very frequently is exercise. Can women exercise in pregnancy? Yes, pregnant women can exercise. If you're having a healthy, normal pregnancy, you can definitely exercise. Exercise, but it has to be in a moderate amount. Yoga is supposed to be very good in pregnancy. I definitely recommend that. Women who are marathon runners, now their bodies adjusted to that kind of high intensity exercise, and for them there is no reason why they cannot continue that in pregnancy. However, if you are not used to running at such long distance and not have never done any heavy exercises, then pregnancy is not the time to begin those. Okay. Mm, and apart from this, another one which I come across is on papayas and pineapples, whether they can be taken in pregnancy. Well, papayas and pineapples have some substances which are known to trigger labor, but the amount in is quite low. So if you take lots of papayas and you binge eat on that, then they say that there is a chance. But these fruits in moderate amount will give you good nutrition, and you need not worry about any miscarriages or delivery or labor signs. Okay. Now I'll quickly move on to some of these questions. Okay. And I have my first question from Mrs. Lakshmi Mishra, which she's asking me, what care shall I take in pregnancy? What is the care during pregnancy? So care during pregnancy is, first of all, you need to keep yourself healthy and normal. Have good regime in terms of eat good nutritious diet at small frequent intervals. Have an early dinner at night, because pregnant women can have reflux which gets exaggerated at the later part of your pregnancy and later time of the day. So have dinner early on, take nutritious food, monitor your BP, your weight, and do regular checkups with your doctor. This is the commonest care during pregnancy. Apart from this, I always tell my patient, keep exercise, keep your body fit. So do work. If you're doing a job, continue the job. If you're doing any kind of work, do work. Do not stop any kind of work, and pregnancy will move on perfectly normal. Okay. Uh, then, okay. So I have a question from Mrs. Bhavna Anatkat. She is asking me, how can I improve baby's brain during pregnancy? Well, this is something like Garbhasanskar. Okay. First of all, understand that the baby has got your genes. So baby is going to be as sharp and probably more sharp and intelligent than you. Okay. So that is one point. Apart from that, what you can do is, you listen to all these sanskars and good stuff and read good books. And thirdly, there's a role of DHA, the decohexonic acid. It is said that DHA is required for the human brain cells to myelinate and improve. And this is usually given during pregnancy and during lactation for better baby brain growth. So my next question is from you, Mrs. Manisha. She's asking use of NT scan. So as I was discussing earlier, Mrs. Marisha, okay, Mrs. Marisha, that scans in this day and age have been frequented. But we are doing a lot of frequent scans. But do understand when we do these scans, we have only you and your baby in our mind. Okay, we are wanting to take the best of care of you. NT scan is called the neutral translucency scan. This is done around the 12 weeks of pregnancy. It is done to detect any abnormalities in the pregnancy in terms of whether the baby is at risk for Down syndrome, one of the most commonly associated conditions where the baby is a little challenged mentally, okay, and syndrome 18 and syndrome 13. So NT scan is done to detect whether the baby has any abnormality in terms of any genetic abnormalities and to pick up some of the structural abnormalities. It is extremely useful for all us doctors and it is like a mandatory thing right now, recommended by all the guidelines of gynecologists all over the world. And you should be doing that. Okay. Uh, I have a question from Mrs. Madhvi, she's asking, hello doctor, taking too much rest is bad in pregnancy? Well, Mrs. Madhvi, taking too much rest is not bad in pregnancy, but what happens when you take too much of rest or uh, you tend to become lethargic, you are taking some amount of extra calories invariably, you tend to put on weight which was not required, okay, and it makes your body less fit. You're not fit, and then when you need to move you get tired too easily. So rest and moderation is required. In fact, in the later half of pregnancy we definitely recommend 8 hours of sleep at night and 2 hours of sleep in the afternoon. Okay, so there's a question from Mrs. Lakshmi Mishra, another question where she's asking whether a healthy pregnancy means a healthy delivery. So, healthy pregnancy and a healthy delivery are two different things. Healthy pregnancy is wherein your pregnancy have moved forward. That is, you have had no complications. All your parameters during your pregnancy throughout the 9 months have been good, and your doctor has been very happy with you. Healthy delivery, I'm not sure what you wanted to ask. I think that means that is it a normal delivery or not? Okay. So first of all, please understand my views. Normal delivery or cesarean are two modes of delivery. The idea being to keep mother and baby safe and happy. Okay. It The course of pregnancy may or may not affect the mode of delivery. So if there are complications in the pregnancy, yes, the chance of cesarean increases, but not necessarily always. Okay, and even if you have a healthy and normal pregnancy, still there is a chance of cesarean. Cesarean is no abnormal delivery. It is done when it is indicated, and it is done best for you and your baby. Okay. Okay, that was one question. Now let's move on to another one. Okay. Uh, okay. So okay. There's a one question from Mrs. Kavita Sahani. She's asking, what is the role of my husband during pregnancy? Well, your husband is the father of your child, and in my opinion, he is as much involved in pregnancy as you. Like I had someone telling me, okay, it is not the woman who is pregnant, but it is the couple who is pregnant. And I believe that we would definitely want to experience your experience during pregnancy. For unfortunately, he can't fall pregnant. And it is always good to have a supportive husband who supports you, especially during delivery, which could be very stressful. And post delivery, when you have a lot of nights and he's there to help you and your baby, so that both of you are more comfortable. Okay. Okay. So I have a question from someone. She's saying that I have sharp pain in lower abdomen during my 6th month, and she's probably in the 6th month of pregnancy. Okay. I am sorry you've not described much about this kind of pain. Sharp pain is not normal. Okay. So it depends on the intensity and the location of where this pain has started that we need to then follow it up. Okay. But some amount of pain during pregnancy, what I'm going to explain is about pain during pregnancy. So some amount of pain or discomfort is there during pregnancy. Right from the first month, the uterus was just so small, around 6 centimeters. It suddenly started stretching out. So you'll have something called a stretch pain on the right or the left side. So that could be there. As the uterus moves forward, there are always contractions. These contractions are they come and go frequently, which will cause your abdomen to become hard, which is again normal. But any kind of pain which is sharp or it comes from the back, goes down, is associated with any discharge from the vagina, they need to be followed up with a doctor to understand what is happening. Okay. Mm, okay, there is one question from Mrs. Aisha. She's 30. She's saying she's 31 years old and 15 weeks pregnant, but my doctor has not recommended any NT scan or any test. Should I ask my doctor? Yes, Mrs. Aisha, please definitely ask your doctor about this. Now, understand that at 15 weeks, NT scan will not be able to be done. So, what you can now do is get the quadruple marker and the anomaly scan for yourself, which will definitely help us assess your baby and see further. Mrs. Marisha has now asked me, what is the recovery time after C-section? Okay, recovery time after C-sections is Marisha. Now, if this means in terms of how you mobilize, so as at my practice, after first 24 hours of C-section, my patients are already mobile. They're moving around the wards. They're already feeding their babies, and they're pretty much comfortable. What I've observed is that post delivery, the first time the woman gets up from the bed after cesarean is the time when she might feel the maximum pain. But once she moves around, they're perfectly comfortable, go back home happily. Okay, so I think that's what you want to know. Okay, now let's talk about. Mm, mm, so my next question is again from Mrs. Aisha. She is asking, can I use pillow under my stomach when I sleep on left or right side? Yes, you can use. Now you're 15 weeks of pregnant, so currently the tummy is not that grown, so pillow under the tummy is fine. Usually after the 6th month, when the tummy has grown a lot, you will be a little more uncomfortable with the weight of the baby. That's when a pillow under the abdomen or the tummy will work way better for you and you'll be comfortable. There's a question from Mrs. Nisha Chiplunkar. She's asking, what is the position of the baby in the 7th month? Okay, Mrs. Nisha, what happens is babies are usually moving around a lot in the fluid in your therefore the position is quite variable. Usually after the 7th month, these movements are more restricted and most of the babies will go head down. So head will be below and then legs will be up. But not all of them. There are still some babies who maybe, either transverse, that is, the head is on one side, legs on the other side, or breech wherein the legs are down, but they still can change the position and become head down in the subsequent months. So I hope this will answer that question of yours. Hmm. So Mrs. Marisha is asking, heartbeat can be heard from what time? Okay, so Mrs. Marisha, heartbeat comes in the baby at 6 weeks of gestation. And as soon as you've fallen pregnant, your pregnancy test was positive. 2 weeks after that, when you do the first ultrasound, you usually see the heartbeat of the baby. So heartbeat is present from 6 weeks of gestation. But what if I'm not mistaken, what you mean is when you can hear it when the doctor checks you. Usually we as doctors can hear it after 18 weeks of gestation on most of our doctors. Okay. So there's one more question on how much sleep is good. So I've already answered that. So 8 hours of sleep at night and 2 hours in the afternoon is adequate sleep for any pregnant women. Mm, okay. There are these two questions from Mrs. Durga Salvi. She's asking, does crying during pregnancy affect the baby and can arguing affect pregnancy? Mrs. Durga, as listening to these questions, and I can just say that pregnancy is a very stressful time. There are a lot of hormonal imbalances which can put uh, a woman susceptible to crying a lot more. Okay, do understand the baby is well protected and will not be harmed by your emotions. Keep love in your heart and you will do fine. Okay. So that was the most common questions which I thought, and there are a couple of myths I still wanted to discuss. So another thing which I had come across was heartburn means the baby has a lot of hair. Okay, so please understand, heartburn is common in pregnancy. This is because there's a lot of reflux in a woman, which increases over subsequent months, and this is not associated with any amount of baby's hair. So that is not associated. If you have a lot of heartburn in pregnancy, you may require antacids or antacid syrups to prevent to make you more comfortable. Okay. Um, Another thing which I have come across is your skin will glow in pregnancy. I I have a lot of patients who come into the clinic and say, we've always heard that pregnancy brings a glow to your face, and I only have pimples and acne, and I'm looking terrible, or my skin, in fact, has degraded from what it was before. And it is a fact. What happens in pregnancy is usually they say that the blood vessels dilate, so there is a glow in many women, but some of these women will not have that glow. Instead, they are prone for acne breakouts. They'll have those pimples and scars. Some of them will have big black marks on their tummy, on their hands. Understand these are all temporary. Once the pregnancy gets over, they gradually will go out. Okay, so that is about pregnancy. Mm, there's one more thing which I heard was you should not raise your arms above your head when you're pregnant. I don't know who started that. Probably it was with the worry that baby will come down or you'll have a delivery, but no, that is not the case. You can stretch yourself as much as you can. Nothing will happen to the uterus. It's a very strong organ and baby is very well protected inside your body. Okay. I have one question from Mrs. Aisha that just came in. She's asking, I'm not able to brush in morning. Any suggestions? Okay, that's a good question. I forgot to discuss. So morning sickness is very common in pregnancy. People believe that morning sickness happens only in the first 3 months of pregnancy, and it is only in the morning. Okay, what it means is actually that woman feels pukish or nauseated when she wakes up in the morning, and if she brushes or does anything of that sort, she usually vomits out. So, Mrs. Aisha, the best thing for this is you eat a cracker biscuit or a dry toast. So, this is what I recommend to all my patients. And in the morning, when you wake up, instead of brushing, which I understand is a habit, but it's better to have a cracker biscuit or a dry toast, something very dry, few bits, and then you proceed to brushing. It will keep your tummy calm and you will be comfortably brush and then move on to your rest of the activities of the day. Okay. And so that was it about myths and pregnancy, myths and facts about pregnancy. Mhm. Okay, there are mm, so there are some of these myths. Please understand these myths. There is a big list of these myths, and they are as big as a 9 month pregnant woman's belly. But if you are in this happy period, try enjoying your pregnancy and do not believe in all this misinformation. Try clearing your doubts with your doctor. Okay. I have one last question from, I'll take it from Mrs. Nisha Chipundar. Is pomegranate good to have during pregnancy? So yes, pomegranate is good to have in pregnancy. It is rich in iron and folic acid. Only thing is some patients are known to get constipated, so don't binge on it. Keep it in moderate amounts and you will do well. Okay. I wish all the patients who have logged in right now best of luck for your pregnancy. And if you have any queries, anything, you have my referral code Namrata. You can always post your queries and I'll do my best to answer them. Right? Okay. Okay. So I have few more quick questions which are coming right now. I'll just take them. Okay. There's one from Mrs. Rachel which suggests what she's asking, what are the causes of abnormalities in baby during pregnancy and what are the symptoms of unhealthy pregnancy? So, Rachel, please understand uh, there is no such symptom which suggests that the baby becomes abnormal. First of all, abnormality in baby is usually spontaneous or genetic. That means genetic means that it was in one of your genes in which runs in the family. It has been inherited by the baby, or you all are perfectly normal. However, there is a spontaneous change in the gene which has caused an abnormality in the baby. Such babies are not big. You as a mother cannot identify, nor as a doctor when I see you can say you are carrying an abnormal baby. We need to do ultrasounds wherein there are some markers which we look for as doctors and then identify whether this baby is at risk for any abnormalities. Okay, this is how we identify. Please understand, anything you eat or you do does not increase or decrease the risk of abnormality in the baby. It is inherent and it will be there. You may it and you are not to be blamed for it. Okay. So that was my last question. I'll try my best to answer these questions later on. Okay. Okay. I thank everyone. Take care. End stream करना है ना? End करो ना?